Hello, everyone. Good afternoon, good morning, good evening, depending on where you are in the world, and a happy International Athletic Training and Therapy Day. Thank you for joining us for this session entitled Athletic Training and Therapy. Where are we now? The growth of a global profession. Before I hand it over to our host, Cathy, I'm just going to run through some quick housekeeping so that the session can run smoothly, and then we'll get everything underway. So the session is being recorded today. I'm going to make a link available to everybody afterwards. That will be up on the WFATT website, and we will send an email out to access that as well to everybody that's registered. We'll provide a certificate of attendance to everybody who's joined us live in this session today as well. We would love to see where you're all joining us from. If you could use the chat function for that, please, which you should see in your menu at the bottom. It would be great to see which countries and professions we have represented today. If you have questions for the panel, please don't use the chat. Please use the Q&A, which is a separate option on your menu. You'll be able to review all the other questions that have been posted as well and upvote and comment on those. The panel will be reviewing those as we go through the session. We might take some of them if they're particularly time relevant, and if not, we'll try and cover those questions at the end. At the end of the session, all being well, if the technology is working, you should be automatically directed to a post-event survey, and we would really appreciate your feedback. It helps us to improve these sessions as we look to do more of them in the future. That's everything from me, Cathy. I will hand over to you, and I hope everybody enjoys the session.
Thank you, Ollie, and I'll just add my greetings to everybody to the second annual International Athletic Training and Therapy Day. Want to just start out by thanking Ollie, who actually did the technology and the whole setup for this. Ollie's the registrar for BASRAT, so also thank you, BASRAT, for all of the technical support. And Glen Bergeron, of course, who did much of the communication to get this panel session going. Our objectives for International Athletic Training and Therapy Day is to flood the social media with posts from athletic trainers and therapists worldwide who are doing the things that they do on a daily basis, supporting active populations and trying to keep people healthy. Last year, we had over 1 million hits, and it would be great if we could do the same or better this year. Post once, post often during this webinar, and for the remainder of the day after this session. We really are trying to get the word out about athletic trainers and athletic therapists that are doing great work. Again, this webinar is sponsored by the World Federation International Development Committee. And we have, as in the International Development Committee, an advisory panel. And these individuals are the ones who are listed here to promote this panel. And so they will be giving their insights from their part of the world, from their locations, as to what is the status of AT&T currently, and what do each of them see as the future for AT&T. So let me go around the room and we will introduce our panelists, and they will give just a short blurb about where they are, and then we will begin our panel. Mike Ferrara, who was past president of the World Federation of Athletic Training and Therapy, could not attend today. But I am also a past president of the World Federation, Cathy Ortega. My current position is University of Utah. I'm a pathway director in a DPT program. We have Larry Leverenz with us tonight, who is a past president of the World Federation in 2011 to 2017. Larry, greetings.
Good morning from West Lafayette, Indiana. I'm retired program director at Purdue University, and as Cathy said, past president of World Federation.
Thank you for being with us, Larry. Glen Bergeron is the immediate past president of the World Federation, serving from 2017 to 2021, and he serves as the executive liaison to our committee. Hello, Glen.
Good morning. Yes, it is morning here. You see in the background, it's still pretty dark in here. The daylight just going to start coming, but yeah, I'm the program director at the University of Winnipeg, and I just sent a little note on the chat that I'm proud about the fact that we had so many of our students that are online this morning. They all got up early and And now I know that they won't be late for class.
They grow them strong in Winnipeg. Ed Ryan is the former medical director of the United States Olympic Committee and has worked extensively with USA Basketball. Ed, hi.
Good morning, Cathy. I too am an athletic trainer. Right now living in Orlando, Florida, doing my best to dodge a hurricane.
Oh, right. Oh, our thoughts are with you. That's right. And we have Steve Aspinall, the Chief Executive for the British Association of Sports Rehabilitators.
Hi, everyone. I'm in sunny Shropshire. The weather is nice and calm on the Welsh borders. That's where I'm based. And as I'm the Chief Exec for British Association of Sport Rehabilitators and Trainers. And I'll obviously give you a bit more information about that later.
Great, Steve. Thank you for joining us. We have Hideyuki Izumi. He's from the Tokyo Ariake University of Health Sciences.
Thank you, Cathy. Good evening. It's 9 o'clock in Tokyo, and I'm Izumi. I'm a professor of Tokyo Ariake University of Health Sciences, and I'm teaching athletic training education program in Tokyo. And also, I'm a past president of the Japan Athletic Trainers Organization.
Thank you for joining us, E. We have Ella Bean from Ono College, Tel Aviv, Israel.
Good afternoon, everybody. My name is Ella. I'm the program director at Ono Academic College of the sports therapy program. And I'll tell you about it a little later.
Very good. And we also have Alexandra Lemke. She's the World Federation of Athletic Training Therapy co-chair of Marketing and Promotions Committee. She is also a faculty member at Virginia Commonwealth University. Greetings.
Good morning, everyone, from Richmond, Virginia. Yes, as Cathy said, I'm the co-chair of the Marketing and Promotions Committee. My other co-chair, Sam Walton, unfortunately could not be here this morning, but he will be celebrating International AT&T Day as well. Yeah, thank you very much for having me.
And thank you so much, Alexandra, for all the work that you and your committee has done to get this day going for a second year in a row, and all of the marketing that's being done to bring attention to our profession. It's great. So let's start to hear from our panelists. What's the status of AT&T in your part of the world? And I'm just going by our list of panelists. So Larry, you're up.
Thanks, Cathy. I think certainly the big deal about in athletic training education in the U.S. is the switch to the entry-level master's program, and all of the institutions should have done that by now. And I think it really is kind of finding its legs, that changeover. I think it's going to be interesting in the next few years to see how that plays out, both from the student standpoint, as far as how that affects them in the job market, how that affects maybe their salaries, and certainly from the institution's standpoint, how that affects the programs in different institutions. You know, are the number of programs going to remain the same, or are some of the programs going to be dropped because institutions just can't maintain that master's level program? So that's certainly, you know, one area that's being looked at pretty closely. I think that, you know, I'm seeing a lot also talk about how changing this master to the master's program, is that going to affect salaries? There seems to be a lot of jobs out there, but you know, how are those jobs going to look with a master's degree and the salaries that they're proposed? So you know, some I won't call it turmoil, but a little bit of shakeup in at least in the education side of athletic training in the U.S.
Thank you, Larry. Good information, because I think the level of education varies around the world. Glen Bergeron, what's your take on the status of AT&T in your part of the world?
Yeah, okay. So I'll be speaking from a Canadian perspective. First of all, I want to say we made T-shirts at the University of Winnipeg for our students. So I want to make sure that they all wear their T-shirts this morning, and they'll be wearing them in class and working with their teams today. So we're pretty proud about having made the T-shirt. So if anybody wants one, you can send me a little note, and I'll send it to you for, I don't know, $150 a T-shirt or something like that. They're pretty special.
Always looking to raise revenue, Glen. Thank you.
Exactly. Yeah.
Appreciates that.
From the Canadian perspective, athletic therapy is pretty healthy. We're a small organization. We're about 3,000 athletic therapists across the country. We're a huge country. We have 9 schools in athletic therapy, potentially having another one coming on board. And they're all pretty healthy. They all work well. As I said, we've got some number of our students online here right now. One of the things, much like what Larry's talking about, is that there is this discussion happening about moving from an entry-level bachelor's degree to an entry-level master's degree. Some of that pressure is coming partly for some of the things that have happened in the US, but also things that are happening domestically here in Canada, where physiotherapy has gone to entry level, as has occupational therapy. And so and some of the other allied groups have gone to the master's level. So we actually, just this week, the Canadian Athletic Therapy Association has commissioned essentially a task force or a committee to look at the pros and cons of entry level. We do have one master's degree program in our French institution in Quebec, at the University of Quebec, Trois-Rivières. And then we just actually are approving one that's about to start. It's a master's degree at Brock University. So we already do have some degrees that are masters, and some that are, the majority of them are bachelor's degrees. So that's going to be an area of discussion and an area of evolution that we think that will be happening over the next couple of years. One of the things that we enjoy in Canada a lot is that our certified athletic therapists have direct access to patients. We have a considerable support and coverage from insurance plans. So many people can move directly into private practice, open up their own private practice. And it's gotten to the point now that that's evolved, that those people who open up private practice are now expanding their practices and they're hiring people. So that's expanding the job market, which has been great. And the other thing that's happened over the last little while too is a much more of an interdisciplinary working relationship with some of our other allied health professionals. So a number of clinics are multidisciplinary, including massage therapy, chiropractic, athletic therapy, physiotherapy. Some are using strength and conditioning people. So there's quite a market and an evolution of the profession in the public domain, which we're really happy to see.
Thank you, Glen. I think that government recognition is really quite valuable for a profession in a given country.
I probably should say just with respect to that, I'm sorry, but the government recognition is much of it is by the fact that we've been around since I think we're also 50 years now that we've been around, but there is no legislation in any one of our provinces. We have the 10 provinces and two territories. We don't have legislation in any one of them. We've been operating on the good faith of the profession and our membership, but there is a strong initiative for every one of our provinces to start to move towards legislation, and there's at least 3 of them that are very close to moving that way. So that'll be, again, another step in an evolution in the development of the profession of getting that legal legislative status.
Thank you, Glen. Ed Ryan, from your perspective and where you sit, what's the status of AT&T?
Well, thanks, Cathy. All of my career has been in competitive sport. It's been in professional sports or Olympic sports, and as well as from the perspective of an employer. So as someone who has interviewed, hired multiple athletic trainers in my career, I can honestly say that I am not a great supporter of the master's degree entry level because I have not seen the qualifications change over the years. I have not seen that happening. I do understand that athletic training has a strong foundation in competitive sports, requiring athletic trainers to be multidisciplinary. And that ability is what has enabled athletic trainers to expand into other areas and be able to take care or provide services to the physically active beyond just a competitive athlete. Another, and I do believe that that's exceptional growth, and I support the expansion of athletic trainers into those areas. Since this is an international group, recently I had the opportunity to engage in an exercise where the discussion was, how many countries have you visited? and what has been the percentage of the world's population that you have encountered. My tally was 63 countries, but interestingly enough, less than 40% of the world's population, because I have not visited India. So, I think that we need to continue to remember and expand our vision, because we are now a global society. And one of the things that I really like about this group is that it is the recognition that many people, regardless of the initials after your name, provide similar, if not the same, services to competitive athletes and the physically active. So I'm not quite sure I covered what my perspective, other than to say that I'm not a big fan of the entry-level masters, but I do believe that foundation in competitive sports is really the thing that separates athletic trainers and therapists from other disciplines that provide services. Thanks.
Thank you, Ed. Gosh, a lot of great points in there that we're definitely going to follow up with. Let's go ahead and go to Hideyuki Izumi.
Yes, in Japan, athletic training was introduced by NATA members back in 70s, and we have our first BOC ATC, back then NATA ATC, in 1977. And we developed our own domestic credential and accreditation program of athletic training in 1994. We now have 71 schools providing athletic training education program, which I'm teaching one of them at. And we have now about 5,300 domestically credentialed certified athletic trainer, which is JSPO, Japan Sports Association certified athletic trainers. And but athletic training is not regulated in Japan, and it is JSPO is credential is not healthcare license, which has to be regulated by Ministry of Health and Labor. But JSPO provide this certification as a sports instructor license. But in reality, when they full-time athlete trainer practice, about half of them have other healthcare license, such as a massage therapist and a physical therapist. So that's reality, and about the 20% of out of 5,000 practicing or working as a full-time athlete trainer in our country.
Thank you, E. Really some helpful background about where athletic training has been and is now. I know that's just a couple of sentences about a long decades profession developing, but thank you for that. Ella Bean, you want to go ahead and speak to us about what's your perspective where you're sitting?
Well, I come from Ono Academic College, which is the only college in Israel that teaches athletic therapy. We opened the program in 2018. We have four classes of graduates. In 2018, there were less than 10 athletic therapists in Israel. Today, there are about 200. Still very little, but much more than what they used to be. I'm very happy to say that all our graduates find work and find jobs as athletic therapists. The studies in Israel, it's a bachelor degree, 3 years, just like in England. And the most prominent thing that happened in the last year is the war. The war affected us tremendously. Many of our students lost their loved ones, family members, friends. And a lot of our students serve in the military. So we really had to work very hard to keep them all balanced and to help them get to where they have to go. We taught the same courses over and over again. We gave them really a lot of talks, a lot of hugging. And I hope we all be in a better place by next year.
Ella, our positive thoughts and support continue to go out to you. I know in our committee meeting, you've shared that your students have graduated and your students and your enrollment is full in this subsequent year. So it seems like you continue to support the profession in spite of all the challenges. Thank you for the work you're doing. Alexandra Lemke, do you want to go ahead and also chime in your perspective?
Yes, absolutely. So I think we've heard really well from the previous panelists about kind of the state of athletic training in the US. I'll take a slightly different approach, as in my current role, I'm primarily research. So this is going to become really important with the switch to an entry-level master's, as there may be some requirements for a thesis or some other sort of capstone project. So the state of research is really, really key in athletic training right now. Not to mention PhD programs and other continuing education within the profession. So this is really going to contribute back to the evidence-based medicine. And I think that the really primary points right now in the profession are about injury prevention and how to treat our athletes and other folks that we care for more effectively. So I think with the evolution of big data and wearable technology, this is going to become kind of the point forward for the profession here as well, to measure more about what's actually happening during regular activity and how can we optimize care from those data points.
Thank you, Alexandra. This is going to be great feedback, I think, for the profession as a whole, and of course for the US that is going through changes. You know, we have another aspect to the question that's more future looking, but because we're still speaking about the present, we actually have a question in the chat. Welcome, Richard Demont, who's written a question, sorry, not in the chat, in the Q&A section. And I thought I would put this out to the panel because a couple of you have spoken about this. And Richard says, AT has been a challenging job with heavy time commitments and moderate pay scale, especially at the entry level. Have these conditions improved in your part of the world? And if not, what is your association doing to improve these conditions? And I'll look at our panel, and the first person to unmute, I'll just go ahead and call on if somebody has some thoughts about that. Go ahead, Glenn.
Cathy,
Oh, Ed Ryan and then Glenn. Go ahead, Ed.
sorry, Glenn, I didn't raise my hand. I just unmuted.
That's great. Go ahead.
I have a question back to Richard regarding whether what the definition of entry level is, because I think that the public perception of athletic training and athletic therapy is that those that work at professional sports level or the higher competitive level have better skills or broader skills. And I would argue that those that work at that level have the greatest support to call upon. So from that perspective, I don't think it should be defined by the competitive level. With regard to where, and thank you, Richard. I saw your chat response, 3 to 5 years. I think 3 to 5 years of experience certainly is entry level. But again, the skill set really doesn't change. In essence, the experience just gives you confidence in employing the skills that you've developed and learned in your education. With regard to what associations are doing, personally, I don't think that the NATA is doing enough to promote improvement in pay scales, et cetera. Recently, I was working in professional tennis, and when I was hiring people, I repeatedly said that this is not a 40-hour-a-week job. And in competitive sports, I don't believe that there is a 40-hour-a-week job. However, I don't believe that there's a 60-hour-a-week job required either. So I think as long as individuals understand that it's not a 40-hour-a-week job, but they're not expected to live there, then I think that it's their responsibility to negotiate their compensation. And, like I said before, I don't believe that our association, the NATA, does enough to equip athletic trainers to negotiate salaries and to demand appropriate compensation. Thanks.
Thank you, Ed, for those comments. Just a comment about the 3 to 5 years. I know in the aspect of teaching, learning, when moving from novice to expert, many times we'll say it does take that 3 to 5 years for a clinician to be considered expert. 3 years kind of being that cutoff, at least is what is typically used. Steve, let's go ahead and Steve Aspinall, let's go ahead and go to you. I knew your organization over the last decade has done a great deal with regard to this area. And then we'll come back to Glen Bergeron. Go ahead, Steve.
Yeah, I'll give a little bit of an introduction to the organization. That kind of go to answer Richard's question as well. We've gone through massive changes over the last, especially over the last decade, because it's just over a decade ago now that we actually applied to hold an accredited register in the UK, which is overseen by our top medical and healthcare body. And that has changed us as a profession beyond recognition, really, because we've gone from a membership body where we're trying to put together the, the best curricula, the best kind of accreditation processes, supporting the professionals. We've gone to a position where actually we're monitored and audited pretty much constantly now. And every year we go through an application process for renewal that actually lasts anything between 6 and 10 months. So we probably get a few weeks in the middle of the year where we're not part of this, where we're responsible to the oversight body, where we're providing answers, information, and showing how we're developing appropriately in relation as well and commensurate with the rest of our healthcare and medical professions in the UK. So we're now held to a much higher standard than, say, for example, we were, kind of 12 years ago. I would say we're totally unrecognisable as a profession. What that has also meant, though, on the positive side of it, has meant that we're very much involved now in the healthcare landscape. So we're getting involved a lot more with national workforce planning. We're part of national workforce planning groups. We work with a lot of our regulators and professional bodies. We spend a lot of time. We've been very well supported by the Chartered Society of Physiotherapy in the UK. And we started doing a lot more kind of joint projects with them. And on the back of all of this, we've also been working with our National Health Service. And this is one of the things I think where we've started to put the work in that sees a big difference in those salaries as well, because we used to be capped at a really low banding. So what we tend to find is that a lot of our best registrants would actually hit that ceiling, and then they'd go and do a master's in physiotherapy or another healthcare profession, and then go down that route, so they could actually get the salary that they deserve for their skills, their knowledge, their experience. And now that has started to change, which obviously makes a big difference for us in the UK. Professional sport in the UK is a much more complicated and quite a difficult answer. And I think the pay across the board for all the professions working in kind of the healthcare side, the medical side, is really quite challenging in sport in the UK. And I think it's very different to the situation you might find over in the United States or over in Canada. So we tend to, I'd say we're kind of focused on this really more on the general kind of healthcare side, as opposed to specifically focusing on the sports side. Although there is quite a lot we do, especially around things like organisations trying to get people to work for free, internships, where that gets abused, we do whatever we can to try to support our registrants there and actually kind of help around that. One of the other things that's really helped us in the UK is we have to now kind of come at things from a slightly different angle. So in the past, we're trying to think about the best professional, and how can we treat patients in the best way? How can we make sure patients are safe? But what we're also having to look at now is, okay, well, what harm is coming to patients from all the healthcare professions? And we have to work backwards from that and actually start using that information to develop and change our programs. So even, from the first week a student starts, we need to start thinking about, okay, well, what can we do differently to make sure that our registrants or our future registrants are actually in the best position possible to not only work to the highest levels, but also make sure they're protecting the public as well. And then I suppose the other big thing that's been a big development point for us, and for slightly different reasons as well. Now we have the international arrangement, so we have this portability between our countries, which is absolutely fantastic. But from our perspective as well, it's also been a brilliant check on exactly what's happening at universities and institutions. So it allows us to look at what's going right, what's going wrong, and actually getting that institution engagement. So we're not just using it as something for someone who wants to be registered to do. We've integrated it into our accreditation processes, so the institutions have to now engage with us. So we've got a much better idea of what's going on at universities. And that obviously will help to drive up quality over these next kind of decades, which hopefully should be a really big positive for the profession. Probably one of the biggest things I've seen as well, if we give our registrants the support they need, they can go out there and they can do the most amazing work, and they're the best ambassadors. The people out there actually doing the work every day, 7 days a week, they're the ones who are changing our profession. They're the ones who worked throughout the pandemic. They're the ones who've helped us expand into lots of different areas as well. And they're the ones who, kind of work with teams of different healthcare professionals, nurses, physiotherapists, occupational therapists, And it's that teamwork that's actually really, really making a difference. And teamwork is really, really important. You know, no profession exists in a silo. And that's probably one of our biggest messages that I'll try to communicate is that it really needs to be about teamwork. It's not just about a specific profession. It's about teamwork, and it's about getting the best outcomes for patients. It's about being efficient. It's about being effective. But it's been really exciting, you know, kind of seeing the growth of our professions and how we change. And we've all got a huge amount of work to do. And I don't think that work will ever stop, but it is fantastic to see how people are coming together from different professions to try to do the best for patients. And it turns out it's the best for us as well. So, which is good.
Thank you, Steve. A great comprehensive answer. Glen, I remember having attended a couple of your CATA meetings just with regard to regulation, how some of the ATs in Canada would say, well, out west, it's the Wild West. They don't, you know, tell us a whole lot to do. So we do what we can and we just stay safe, kind of thing. So it's interesting where you all find yourself. You want to go ahead and give your insights?
Yeah, I guess from the standpoint of Richard's question about trying to make sure that people that our members are adequately represented from a financial perspective, most of our provinces will regulate. They'll establish recommended fee schedules, and so I can speak from Manitoba. Every year we set up a recommended fee schedule, and our members are allowed to either charge higher or lower, but it does sort of set a bar by which we can compare, and that bar is very much in line with other allied health professionals. And so we try and make sure that the public knows that, you know, we're no different than other there are physios and chiropractors and massage therapists, that we have a similar fee structure. And so from an association perspective, that's what we've been doing. And the other thing is, the thing we have to do is we need to continually brand ourselves into the public so that the public knows that this is an option to come to. Repeatedly, I get from patients who come to our clinic as I wish I knew about you long before I would have come to this. You know, this is what I needed. And so for us to continue to keep doing that is an important thing. One of the things that the Canadian Athletic Therapists Association did a few years ago, and Richard will remember these, Dave Paris a number of years ago, did a salary survey. So he just did a survey of all of our members. You know, what were their working conditions like? What were their salaries like, et cetera, et cetera. And then that was a reported thing that we gave out. So it kind of gave us some information that was happening across the country. And I remember actually using that data when I had to go and negotiate with our university in terms of my salary. I said, here's what this is the landscape across the country. And we've asked actually the CATA as well to see whether or not that was something that we might want to reinstate. I think it's just really important to know what the financial situations are with people, and they can use that as a negotiating point when they're talking with their employers. So that would be something that if I said to the NATA or any other organization that maybe that's something we should come back and do. The other thing is for us, for example, is we do have insurance reimbursement. So our association is constantly promoting ourselves to the insurance companies to ensure, and some of them pay to the same level as other health professionals. We're on par with them. Some of them are a little bit lower. So and we still have a few who don't cover our profession. So we are still actively working there. And as soon as you kind of get a resource, a financial resource reimbursement, then you can make a living. And then it's up to our students or our graduates to go out and make it happen. It's the entrepreneurial spirit in a lot of cases, because much like what Stephen is saying, you know, the professional sport arena and job market is limited. And so if you want to continue to work in this area, you're going to be working in clinical situations. You're going to work with teams at the lower level. Many of our graduates work clinically, and then they'll work with some of our amateur teams. And there again, with our amateur teams, we have started to really make some inroads there where they're starting to recognize the value of having these people there, and that value has to be expressed in financial reimbursement as well. So we've seen that evolve as well. So those are all very positive things. But like Stephen said, it's an ongoing thing. We continue to keep doing it. I just like to see, one of the biggest challenges we have is our name. We're athletic therapists, and most people in the public don't relate to themselves as being an athlete. So why would I go see an athletic therapist? So, you know, we want to sort of brand ourselves. The fact that we use this is now International ATT Day. So much like, you know, I'm going to go see my PT. I'm going to go see an MD. I'm going to go see an AT. You know, that kind of thing is be able to understand that kind of branding that we do, so people know that we're out there and we're accessible.
Thank you, Glenn. Kind of your answer linking us to the future of the profession as well. Larry, go ahead. And then we just need to unmute. Still happens to all of us.
Sorry about that. Thanks, Cathy.
No
A couple things talking about salary wise. You know, there comes from Ed's point, there are some legal issues and antitrust issues out there in the US that you know, we have to look out for when you get your professional organizations trying to, you know, mandate or even suggest salary levels. So those are important. And in the US, also the point that you know, there are different costs of living in different parts of the country, and I'm sure that's true of any nation. And so, you know, a salary at in one part of the country might be great, in another part of the country might, you know, you might be at a close to poverty level. So it's you know, very different that way, and it's tough to do. I also wanted to come back to the Ed and Alexandra's points. You know, Ed was talking about the practitioner out there, the athletic trainer with the competitive sports, in the competitive sports world. Alexandra's talking about you know, the role of the athletic trainer, faculty member, researcher, and throw the question out, you know, in other countries, are we seeing this division, if you will, not necessarily two divisions of educator and practitioner. We've had for many years that little battle in the US. And are we seeing that in other countries? Are we seeing different roles for athletic trainers, not necessarily just different venues for their practice, but actually different roles out there? You know, is it the same skill set? You know, those kinds of questions that also affect working conditions, salary, those things.
Thank you, Larry. Some good points. I wanted to bring us around to our second question, not negating all that's been talked about. I would reflect a little bit in moving forward here about what Ed Ryan said when he was talking about the countries he's been to, the amount of people that he's interacted with around the world, and how that's been less than 40%. I think when we talk about the professions, sometimes in the North American realm, there's, you know, people vying for market share, and, you know, we want to take care of this group, we want to take care of that group. But I think Ed's comments really point to the number of people who still need care, and the small population that we still interact with, and we need to expand to. We do have a CATA member on our committee that is actually in India, and her feedback from that part of the world is that our footprint as a profession is small, and that we just need to expand that, because there's so much sport and even active population and health issues in that part of the world that our profession could work towards. Ed, I go back to also what you said in this session, but you continue to say over the decades, is, the credentials, the letters are all fine as well, but it's the competencies and the impact that we have that's most important and needed. And again, I think that's what the World Federation tries to do with that large umbrella. I'm gonna bring us back to our question. What do you see as the future of AT&T? And I might start at the back end of our roster, Alexandra, as the co-chair with the Marketing and Promotions Committee. Do you want to reflect on that or share from your perspective on the World Federation Committee?
Yeah, absolutely. From the marketing and promotion standpoint, over the last several years, we've seen a lot of growth. So I've been involved with the committee for the past 4 years now, which is hard to believe, but every year we're seeing a lot more folks get involved, a lot more student engagement. And so I really just see this, and Ella Bean has spoken to this as well in Israel, but there's just a lot of growth and interest from students. In the US, I think it's projected it's going to be a 17% growth on an annual basis for athletic training students. So that's fantastic. I would say, again, from the research perspective, what we're really seeing is this push to get more wearable technology integrated to improve and rapidly translate our findings from research to clinical practice. And I think that with social media specifically, having that platform to reach folks across the world is really, really impactful. And there's a lot more quick, rapid translation of our findings to our patients, to other athletic training and therapists worldwide. So I think that the platform of social media, a little bit biased from the Marketing and Promotions Committee standpoint, it's just going to lead to that more rapid growth and visibility of the profession worldwide. And that's something that we're really proud of. Again, we have a really strong reach, International AT&T Day. We're excited to see the numbers that are coming out, so stay tuned on our pages, but we'll kind of talk about our global reach and how many folks interacted and kind of what we're seeing as the trends on how people celebrate the profession, how people are helping athletes or other patients they treat on a daily basis. So that's something that's really exciting, and I think that the future is just going to continue to grow in that way.
Thank you, Alexandra. Ella Bean.
Well, at least in Israel, I think the future of the profession is going in two ways. One is treating athletes, both youth and professional and all that. But the other thing is using sports and sports therapy as part of a better life. And we see it now in every aspect of the Israeli lives. And the most urgent thing is in the part of the way people feel, the way people experience all the hardship and sports and exercise, and having someone there to instruct you how to do it correctly, how to use your body in a manner that you can feel better with yourself, that you can be more calm, is growing very fast. And a lot of our students are not only working with sportsmen, but they work, as Ed said before, with the physically active. And I think it's a very important part of the sports therapy or the athletic therapy in Israel, at least.
Thank you, Ella. Hideyuki E.
I've been watching how athletic training has been developed in our country after I studied athletic training in the US back in the 80s. And I think there were many difficulties when we trying to establish athletic training as we're trying to emulate what the US did. But, athletic training, which originated in US. In a country, each country has a different healthcare system and culture and sports culture and economy and history. I think it's very important for us to discuss what approach is best for the people and athletes in each countries through the information exchange like we have today, and to consider what is the best option for them. So what I found is that there's some commonality and the differences when we're trying to implement athletic training and therapy. So the goal might be different, except we all work for the health of athlete and physically active. So we'll keep working on it.
Thank you, E. Steve Aspinall.
Very similar to what's been said, but I suppose there's a couple of slightly different things in there. One of them is when I've been talking about kind of teamwork and kind of teamwork really does make the dream work, and that's very, very true in healthcare. And one of the things we've seen, certainly in the UK, is lots of the professional bodies, lots of the organisations, lots of the different professions all coming together and actually joining together to try to change policy in government going forwards. Now, how successful that's going to be at the moment, we shall see probably over the next kind of 4 to 6 months as our new government starts to design what it's going to do and decide how it's going to deal with the NHS going forwards. But hopefully, as a collective, we're going to start influencing policy and how people actually perceive kind of treatment and rehabilitation. And it's not just about, from our perspective, and hopefully the focus of our students now as they progress to registrants, they understand it's not just about seeing a particular injury. It's about, okay, so how can we make and help this patient live their best life? It doesn't matter what their physical status actually is at that point. What can we actually do to support that and help them live, kind of the highest quality life they can? And that's something that's really, really important that as a profession, I think we really need to focus on, because more and more, when we look at the testimonials from patients, we look at the outcomes in different services, it's the real life-changing aspects of the treatment. It's not just about, I've got an osteoarthritic knee, I've got a pain in my hamstring, I've hurt my back. It really isn't just about that. That can be important. Obviously, it is important for us as a profession, but it's not necessarily one of those life-changing moments. It's not one of those things that actually kind of changes people going forwards. And it's that, I think it's a shift in thinking as well. And say, for example, other things as well. We used to be all just about exercise, exercise, rehab, etc. Whereas now we certainly realise, now we're starting to realise as a profession, that's definitely not appropriate for a lot of people. It might be more about how do we get them to interact more socially. We might think about kind of gardening clubs. We might think about a whole host of different things that aren't just about exercise or rehab. And I think that's a direction that our profession is really in a good position to move towards, and certainly working with everyone around us as well. So I think that kind of prevention is really, really important going forwards, kind of helping people kind of live those best lives. And actually, as I say, changing public perception as well about, what do they get out of going and seeing a healthcare professional, especially one who kind of specialises in the MSK world. What can they actually get out of it? And I'm hoping that we'll see a big shift in perception, and we'll see a lot more people being able to access the services and actually wanting to access the services as well. And obviously, hand in hand with that, we need to make sure that we're hitting all the demographics of our population, because frequently the people who need the rehab aren't the people who get the rehab or get the advice or get the support. And that is something that needs to change. And we're going to spend a lot of time as a professional body working with groups to see how we can kind of change that going forwards, because that's really, really important. Because we need a much fairer world. We really do.
Thank you, Steve, a comprehensive answer from your part of the world. I'm glad you brought attention to one of the 3 pillars, I think, that really are distinctive to the profession of AT. You talked about prevention. And, when I talk to other students, other professions about the distinctiveness of AT, on-field emergency care, end-stage functional rehab, and injury prevention. And I think that aspect that you're speaking about gets us also towards what most people in the world can benefit from, that promotion of health and the prevention of injury and illness. I'll go to Ed Ryan, and then Glen will come to you. Ed, just with regard to the future of AT&T worldwide. Go ahead.
Thanks, Cathy. I'm gonna give up my time since I've shared a lot.
All right. Thank
Turn
you,
it
Ed.
over to Glen.
Glenn, I imagine you might be reflecting about Steve's response, answering this question, but as you do that, I'll go throw one more aspect to you. We have a question from students, and because students are such a large part of our profession and our future and our attendance today, I'll read the question, and if you're so adept, if you can bring in all those three topic areas in your answer, I'll leave that to you. So the question is, what initiatives have you implemented to expand the AT profession on a global scale? How do you recommend AT students like myself contribute to this growth?
Well, actually, I did see Elena's question, and I wanted to make sure that we got it in. That's why I raised my hand.
Great.
Because I did want to speak, on from the global perspective with the World Federation as well, in terms of the things that are our ambition. So when I became president, I gave an initial talk about where I thought we should go. And one of the things I put up was a global map, and there are 206 countries worldwide, and athletic therapy is in about 12 of them right now. So we have a lot of work to do. And we're starting to make some of those inroads, but one of the challenges with the World Federation is to deal with all these various countries that have barriers, and some of these barriers is just time zones. We were just talking today, like there's going to be people who would have loved to have been on this, but it's the middle of the night for them. There are language barriers, there's cultural barriers, and I don't say barriers, but there's distinctions with people. And so it's hard to sort of centralize the growth of the World Federation to one area. And largely, the U.S. was, and the NATA was instrumental in supporting the World Federation for many, many years before it became a little bit more independent. So one of the things we're not in South America, and we're not in Africa. We do have a representation in Asia. We have representation in Europe, minimally, really, I think, because we have the UK and we have Artie, but we don't have anybody in Germany and France, et cetera, et cetera. So there's room to be done there. We are making I think, some great inroads in the Middle East. I think Ella has been amazing in being the champion in Israel and bringing athletic therapy, really bringing it to the forefront in that country. We have some great inroads that are happening in Jordan, and that whole group, and we've reflected on that, and that's sort of, it's referred to as the Middle East, North Africa. That's sort of an area, and we would like to, build some of that impetus there. We'd like to build the impetus in Asia, so that there are subgroups of the World Federation that can move the profession within their own regions and within their own areas of parts of the world. And so that takes more than just an executive of the World Federation or a marketing group here at the World. It takes a group of people in those areas that say, look, we want to take the bull by the horns, and we want to start to reach out to other countries as well. And that can only happen once you've got some reassurance and confidence, and you've established yourself in your own country. Then you reach out. So that's a process that's going to be happening. But I think from the standpoint of saying what is the future, I think that is really, it's an impetus that's starting to move. And we have a member in Puerto Rico now, for example, and they're on international development committee. So there's going to be some inroads into those areas of the country, of the world, I should say. So I'm quite encouraged by what's been happening. But as I think, as Stephen has said, it's up to the individuals at the ground level as well to make this happen. This can't happen at a committee level at the World Federation. This has to happen there has to be a groundswell that's going on. So I'm pretty encouraged about that, but it really is going to take a lot of work, and it's going to be a continual process. The person in India, one person, she's the only athletic therapist in India, and how many billion of people, or the millions of people are in India? But she is making a difference, and it's really remarkable to see how that's happening. I think we have Joelle Redhead here, who's from the Caribbean, and she's making some great inroads as well. So those are areas that we just need people to start to make it happen, and that's one of the reasons why we have ATT Day, is to to really demonstrate the global reach that we have and make sure that we're not alone in our own little country trying to do. There's a big effort that's happening here. We're part of a big picture, and everything that we do locally has a huge impact globally. So that's important. And I think the other one, this is another one, is that the international arrangement that's happening right now. This is going to allow for portability of the credential across the globe. So as more and more of our organizations come on board, that's one of their objectives. We make that very clear. One of your objectives should be that your academic program should qualify for the international arrangement, which then allows your members to have that option if they want to go globally, but also people from other countries can come to you. So we'll have that interchange, and I think that's a really positive thing. I hope I've answered Elena's question, but maybe other people will have more things to add.
Thank you, Glenn, for a comprehensive answer. Just being conscious of the time, we are approaching the top of the hour. We have a comment from Steve Aspinall that we will get to. And Steve, you have a question from a sports rehabilitator from the UK that you might answer offline, because it looks like it is a registered with BASRET individual. But that said, let me go ahead and thank our panel members. We will stay on a little bit longer. And this is being recorded for anybody that does have to leave. But I do want to get to Steve Aspinall's reflection response about the future of AT and also what we've been discussing. But once again, thank you, Ali Coburn. Thank you, Alexandra Lemke, for organizing this event, organizing AT and International AT&T Day. Please continue to post, use the social media, and let's get the word out about what great profession we are. Steve Aspinall, go ahead.
Yeah, just a very quick one about the profession kind of expanding globally. One of the things, obviously, what would be incredibly hard to do would be to kind of try to step into other countries and tell them what they want. One of the things that's a lot easier to do is actually to make sure we're open, we're transparent, and we can actually share, and we can share templates. And that's one of the things we've certainly found as an organization. We share all aspects of what we do in our journey, including everything from, accreditation through to regulation, through to kind of professional membership side. And we're happy to share all of that. It's something we have to produce anyway. We have to make sure we have this complete and detailed framework. And we also work with kind of government health authorities in different parts of the world who've come to us and asked us about our experience as being part of the scheme we're on in the UK. So that's something else that we kind of put ourselves out there, and we've said to our top regulator that we're happy to help and speak to people, whether it's directly related to our profession or whether it's on the periphery of our profession. So that's something else we kind of put out there and do, and we're happy to kind of work in those areas. Did you want me to very quickly answer that question? Because I can answer that.
Sure. This is from Montes Venslovas. Go ahead, Steve.
Yeah, so private health insurance in the UK, just as a bit of a status, it's a bit hit and miss. They've not accepted us in the past. It's not been a decision about skills or knowledge. It's been more about a business decision. But we're doing a massive campaign in the UK at the moment. So we've collected testimonials from huge numbers of patients. We've got lots of big private clinics who are joining in to petition the insurance companies. And we've got lots of the big employers as well. Actually treat a lot of insurance patients and actually run centres who are also petitioning on our behalf. So hopefully that will change in the UK, this recognition from the insurers. But it's more of a business decision as opposed to a you're not qualified to treat decision, which has obviously been a lot harder to argue in the past, but we're getting more and more support. So hopefully that will change. And there are some sport rehabbers in the UK who can treat pretty much any insurance patient because insurance companies can do what they want when they want to do it at the moment, unfortunately, but hopefully that will change. And we're also working with the Association of British Insurers, and our top oversight body is also working with the Association of British Insurers to actually try to change this. So there's people coming at this from lots of different angles to help support the profession.
Thank you for that. And then just one more question by Mark Wojciechowski. He's speaking about the potential excuse me, for athletic trainers and athletic therapists working in the international school setting. Thank you for that comment, Mark. In actuality, we do have a member of a World Federation International Development Committee that works in that setting specifically. So we do try to get information about that. But your point that this is another area of growth for ATs around the world is quite relevant. One of the other items that was in the chat, thank you again, Richard Demont, he put a reference in there with regard to AT internationally, with regard to settings and what is being done to promote the profession. We can make sure to get that out to the attendees as a follow-up to this discussion in case you haven't seen it, but he put that in the chat. Once again, thank you all. And we wouldn't be here, it wouldn't be as much fun if we didn't have attendees listening to us, but of course we wouldn't have an event at all if we didn't have the panelists. So thank you, our World Federation International Development Committee Advisory Group. And thank you for the people that really did the mechanics to put this on. Alexander Lemke, Ollie Colborn, of course, Glen Bergeron that helped to bring everybody together. And the mastermind behind the idea was our past president, Larry Leverenz. So thank you all for your time, and we will sign off now. Take care.
Thank you.